A very good morning to everyone. At the outset, I hope that all of you are very safe and healthy. Also, I urge you strongly to follow all the precautions and stay at home during the lockdown period. And as we understand it inside IAS that this phase is extremely difficult for the UPSC aspirants who are very uncertain about what's going to happen when the exams are going to be held. So we thought of bringing to you the Hindu and Indian Express current affairs analysis on a daily basis. So what this initiative is all about? This is just a summary and a collection of all the news, important news relevant for UPSC that is there in the Hindu and the Indian Express every day. Now before that, let me tell you what is the importance of this particular initiative. When I was preparing and when I was an aspirant, I have seen that so many websites, so many sites already offer a summary of the editorials that are there in the newspapers, a summary of all the important articles that are there in the newspapers. But what I found very lacking and wanting was that even after going through all these summaries and synopsis of the editorials, I always felt that urge to read the newspapers again. And when I read the newspapers, I felt that these synopses were actually missing out a lot of good information in the newspaper. These synopses just don't cover the important case studies, important examples, data, diagrams, etc., which have been given in the newspaper. So I always felt that there is no substitute to the newspaper. Hence, this initiative is to bring before you all the case studies, unique examples, and data, all of that in a very concise and crisp manner so that these can be used in the examinations. And also a lot of time can be saved to extract these case studies and link it to the exact portions of the syllabus where they can be used. Also, before we start with today's newspaper, every day I would be sharing with you something that I find very interesting and that can also be very relevant to the UPSC, which you can use it either in the essays or in the ethics papers. So currently I'm reading this book called as The 7 Habits of Highly Effective People by Stephen Covey. So I found while reading this a very interesting case study. So this was of Viktor Frankl. Viktor Frankl is a very world-renowned psychiatrist. He was also a person, he was a Jew, and he was in the concentration camps during the Nazi Germany era. So he faced really bad and tough times when he was in these concentration camps. There was no food, people were kept naked, and there was a lot of torture that was meted out to them. He saw his family, his brother, his wife die right before his eyes. So he was demoralized to the core of everything and he lost hope in life. So at any moment he would have just given up and he just thought that the next moment he could be in grave. But one day when he was all alone in a dark room, naked, he sat and he thought, what's happening to him? And he thought that yes, these Nazi captors have tortured him like hell, but he still has one choice, he still has one freedom. He felt that there is a stimulus and there is a response, but between these two, there is something what's called as a freedom to make a choice on how to respond. And this freedom he still had. So he felt that, he always says that between stimulus and the response, you have the freedom, you have the choice of how to respond, and that makes all the difference. So this particular story and this particular anecdote can be used in your essays, as a beginning of your essays. It can also be used in ethics, depending upon what has been asked. So now let's start with today's newspaper analysis. Okay, at the outset, let me tell you that the newspapers these days, as you all must be knowing, deal mostly with the COVID-19 crisis that's going on. So we'll start with what WHO Executive Director Michael Ryan had to say. He said that India has a tremendous capability to deal with COVID-19. Now, why this statement is important? It's just a statement and there is nothing big deal about what he has said. It is just in simple words, tremendous capability to deal with a crisis. But this can be used to start an answer which asks about, say, COVID, or it can even be used in essays, which actually gives your essay, gives your answer more authenticity and a little more that extra detail, which might fetch you half 1 mark more, and that's all matters in UPSC. So with this quote, we will look into the various things that have been covered about COVID today. The first has been the various measures taken to tackle COVID-19. Now, before, when I was explaining to you the relevance and the importance of this initiative, so if you just Google what are all the measures taken to tackle COVID-19, probably you would get a list of maybe 10 measures which have been taken, and this 10 measures can be found at many places, which all of us will say just Google, download and read up. But what difference newspaper reading makes is when you read the newspaper and over a period of 5-10 days you collect the measures, they become very original and very unique, and your answers turn out to be very unique when compared to the answers of your fellow competitors, and that's what is really important in UPSC. So here is a list of few measures which I found really interesting and which can make your answers interesting. So these measures can also probably be grouped. For instance, measures like the policy measures, or if some institutions are being set up, maybe institutional measures, or if it is the private sector taking private sector measures, or if it is related to some technology, then it is technological measures, or if it is based on some international cooperation, then at the international front. So these measures can possibly be categorized, and then the measures under each of these categories can be very concisely mentioned. So the first is a technological measure that has been taken. So the example is, that Mumbai has been the hotspot of the coronavirus. So the Brihan Mumbai Municipal Corporation has used GPS data to map high-risk zones in the city. This is even done in Karnataka, where the state government is tracking people who are in home quarantine using GPS. So they have fixed a radius, and if they go beyond that, they will immediately call them and then tell them to be back at home. So this is very important because we have seen cases where people who have been home quarantined are breaching that and they are going outside of their homes, so threatening the lives of other people as well. So this is a very important technological measure that has been taken. The second is a policy measure, or you can say it. The railway board will convert a total of 20,000 coaches into isolation wards. Now this is extremely important because India is a country where we know that the number of hospitals, the infrastructure, the number of hospital beds are always in scarcity, and the number of people who need these resources are more. So at this point of time, with high population density, we need more such isolation wards, and the railway coming up to do this is a very big and very nice initiative. The next is again a technological measure. So here IIT Bombay has come out to develop a portable ultraviolet sanitizer. Now we have these purses, wallets, mobile phones, and you cannot possibly sanitize them using your traditional conventional sanitizer. So you need an ultraviolet sanitizer for that, which a portable model of that is being designed by IIT Bombay. So this has also been made by stainless steel kitchen containers and an aluminum mesh, so which is very good that it is not even expensive and it is portable as well. So this will be very useful in fight against corona. The next step is taken by Tamil Nadu. See, the step is very simple. What the state government has done is, farmers had grown a lot of flowers, and these flowers are perishable items and they will perish in like no time. So if they are not marketed within that time, the farmers are going to incur a lot of losses. So in this time of crisis, what the government has done is it has sent the flowers to the scent factories. Okay, so now this is a very simple measure, but how this can be even helpful and useful in the answers is, for example, in ethics, you have a case study where you are asked if you are a DC of a district which is hit by the corona, and there are some how do you address the problems? There are farmers whose produce is now going to get wasted because there are no transportation facilities. How do you deal with them? So these are some of the simple but yet very innovative solutions that a DC can come out with. So if you make a mention of these in your ethics answers, they are really going to stand out and stand apart from the answers of the fellow aspirants. So this can be used in ethics. Okay, so the next is one whole editorial in today's Hindu newspaper was about what measures the Karnataka government has taken to deal with the COVID. Karnataka, as you know, is at the third spot when it comes to the highest number of cases. So this strategy adopted by Karnataka has 4 pillars to it. One is the technical support, next is a humanitarian approach, and then economic or financial assistance, and then the medical support. Now we'll see each of them. In the technical support, the state government has set up what are called as war rooms. In these rooms, these are high-tech rooms where there is monitoring done continuously, and information exchange is also done regarding how many cases are there, how many people are kept in the quarantine, how many people are recovering, how many people the quarantine is over. All of that is kept track of. And also, as I told in the first slide itself, that Karnataka government is also tracking the mobile phones of quarantined people. They have also formed a Telegram group called as Sahaya. It is a very simple group, like there are some 22,000 people in it as of now. They post very simple queries regarding corona, whatever doubts or fears they have, and immediately they will get a response. So this is a very good initiative. The next category of measures adopted is the humanitarian approach. So the next category of approach is a humanitarian approch. So in this, Indira canteens have already been set up in the state, and these Indira canteens are now being made to provide food free of cost. Also, there is this Department of Information and Public Relations. So this has formed what is called as Janasnehi teams, which means those who are friendly to the people. So they will actually play a very important role in tackling the rumors and fears among the people. And the DCs have also been told that to take some community halls, wedding halls, etc., and then convert them into places where migrants can be placed and they can be taken care of. Okay, so the next initiative is what can be termed as a private sector initiative. Here, Apollo Hospital has tied up with different chains of hotels like Ginger Hotel, Lemon Tree, Oyo Rooms, and Zomato. What basically it does is, Apollo being a hospital, it is facing the lack of sufficient number of rooms to isolate people. So that is why it has, either way, these hotels will be not occupied now because there are no people who are traveling or anything. So these rooms can rather be utilized as isolation wards. And Apollo has tied up with Zomato so that food can be delivered to the doorsteps of people who are living in these isolation wards in these hotels. So they have termed this as Project Stay One. The next measure that has been taken is Garib Kalyan Yojana, in which 5 kilograms of rice or wheat and 1 kilograms of pulses will be given to nearly 80 crore people. And also, this can be again called as a policy measure. What the government has done is it has set up a team under the Niti Aayog member VK Paul. It is an empowered group of officers, and this is on making a medical emergency management plan. So the VK Paul empowered group has been assigned the task of making medical emergency management plan. So this is going to be very crucial in our effort to tackle coronavirus. Okay, so as far as the spread is concerned, as of now, it is spread to over 176 countries. So you can use this data to talk about the spread of the virus, which is unprecedented and very huge. And now let's see what are the negative impact of COVID. First is, it has become a pandemic on the move. All right, so it is feared that 45 million migrant daily wagers are there, and these many are going to lose their jobs. Okay, And also, it is a very sad thing that it is said that the COVID-19 is spread by, it was spread in India by people who travel from abroad, who are wealthy, who are rich, who are influential. But the poor people are bearing the brunt. And if you see the newspapers, they have such moving pictures there where migrants are walking on their bare foot, to even 500, 800 kilometers they are walking to reach their places, to reach their villages. And wherever they are housed in camps, the facilities in the camps are extremely pathetic. So this one negative impact is that the migrants are being extremely negatively affected, and it can be a pandemic on the move. The second is the Rabi harvest. So the Rabi crops are to be harvested, but because of lack of any laborers now, again the Rabi harvest might not happen timely, and we are going to have a lot of crop losses. So this can be again linked to the food security, a threat to the food security. So this is another negative impact. The third is the economic cost. It has been estimated that this corona crisis is going to lead to a loss of 9 lakh crore rupees, or roughly about 4% of India's GDP. Apart from this, there are several other economic costs as well. See, the 90% of the workforce in our country nearly is engaged in the unorganized sector. For instance, in construction or housekeeping. So these people are going to lose their jobs. Secondly, the supply chain might get broken. It is already getting broken. Then several of the industries, they have already locked down, and there is a raw material crunch already. Okay, then is several of these small scale industries, mainly these MSMEs, they are not able to earn revenue now because they are closed, and these have taken their loans, and this might in future give rise to some bankruptcies as well. Now coming to the demand side. In the demand side, there are several consumer goods, and the demand for that has already fallen, and it's to be seen how far and how quickly it's going to pick up. Next is the government. It is the one that spends most on the infrastructure, and this spending will now be low. If its spending is low, then you can imagine that the cement industry, the steel industry, all of these industries will also see a slump. And then what is most visible is the services sector. So name a service sector, let's say hotel or tourism or aviation or our malls and movie theaters, all of them are going to bear the brunt. So this is a summary of the impact that the coronavirus is going to have negatively on the Indian economy and society. All right. So now that we have seen that coronavirus has posed such a huge challenge to India, this is also a time to look back and learn some very important, crucial lessons that India can learn probably. First is the importance of social security. It is said that there can be no social distancing without social security. India roughly spends about 1.28% of GDP on the health. And also WHO report says that 68% of the health expenditure of the people is the out-of-pocket health expenditure. So because of this, nearly 55 million people have been pushed to BPL since 2011. So this is a very alarming statistic, and this shows the importance of social security. And as you can see, only 11% of the workers have any pension schemes, 20% have any life insurance, and only 4% have accidental insurance. So there is the important lesson that we learn from here is to ramp up the social security coverage in India. The second important lesson that we learn is about the health infrastructure. Whether it is hospitals or equipments, research, development of vaccines, doctors, the frontline healthcare workers, there is a need to revamp and all of these. So you can see from this diagram that South Korea has the best statistic ever per 1,000 persons. They have 11.4 hospital beds and 2.4 physicians, whereas India has zero point 0.7 hospital beds per 1,000 persons and zero point 0.8 physician per 1,000 persons, which is extremely alarming. So we need to increase the number of hospitals in the country, and also we need to focus on the medical education in the country to be able to produce good doctors and in more numbers. The next important thing to be seen, the lesson to be learned, is a vulnerable section. These vulnerable sections could be migrants, or there could be sanitation workers. You have seen several pictures where the sanitation workers are trying to sanitize the community taps or any buildings without any protective gear. They themselves do not have masks, they themselves do not have gloves, but they are trying to clean them up so that none of us are infected. So they are the vulnerable sections and they need to be taken care of. This is one of the important lessons that coronavirus teaches us. The next is the importance of environment. So there have been many videos that have circulated which shows that the coronavirus has not had an impact on the wildlife like it had an impact on the human lives. And also because of coronavirus, I have seen in my own neighborhood several birds that I have never seen before. So this shows that somewhere we have really degraded the environment, and therefore and that much of importance to the environment is definitely needed. It's probably because what we're doing to the environment that these dangerous kinds of viruses are being generated. Also, today's newspaper covered an article where the Karnataka State Pollution Control Board has said that the Kaveri and tributaries are now less polluted because not many industries are working and not many people emptying their effluents in the rivers. Okay, so the next is technology as aid. So in a big way, technology is being used, as we have already seen sufficient examples for that. So technology as an aid for disaster management is something that needs to be exploited more and more in the future with the coming up of artificial intelligence, machine learning and all that. Sixth lesson that we learn from the coronavirus is that we are living in an interconnected world. So we better cooperate with each other and coordinate in eliminating any such global crisis. We either live or we die, but we do it together. The seventh important lesson we learn is to bridge the inequality. There's always this rich versus poor. As I said a couple of minutes before, it is the rich who actually traveled initially to India from abroad and brought the virus, but today we see the plight of the migrants who are the poor sections of the society. So because of somebody's mistake, probably some poor person is facing the brunt of it. So to bridge this inequality, that's one important lesson we learn. And also it is the relevance of Gandhiji. You must have seen in several newspaper reports that many people have lied that they said they had absolutely no travel history, but they had a travel history. They even took paracetamol to hide they actually had developed some feverish symptoms. So they have also manipulated and they have escaped the screening at the airports, and so all of these show that why it is very extremely important to tell the truth, because that can save the lives of several of us. So relevance of Gandhiji and his insistence on always telling the truth, honesty as being the best policy, is revealed in this. Okay, so this is about the best practices. What actually happened is the Prime Minister had a video conference with several Indian ambassadors in different countries worldwide, and he tried to discuss with them what are they doing to tackle the crisis, so that he can learn some lessons and that can probably be emulated in India as well. So some of the important things that has been learned are, for example, in Germany. In Germany, the automobile makers companies have been asked to make ventilators. So this way there will not be any scarcity of ventilators. In South Korea, as you know, that the number of cases, in spite of being in the neighborhood of China, are very less. The deaths are very less. Why? Because they acted very early. They followed stringent, strict quarantine measures that nobody is going to come outside. and they ramped up their testing facilities. That was one country which tested even the asymptomatic people, and where it found that even being asymptomatic, they were actually corona positive. So that is why its testing facilities were superb, and it tested a large number of people. So these were some of the best practices that India can adopt. And also, this article shows on the diplomatic front, how India has been able to tackle this crisis. For instance, 500 Indian students who are there in Iran, and we have provided assistance to them as well. And even tourism has been hit in Maldives, so we have sent medicines, a team of doctors, and all that. Okay, so there was this small piece of item in today's newspaper, in Indian Express, where it says Darul Uloom offers building for isolation. It is Asia's largest madrasa. So what it has done is it has given to the Uttar Pradesh government to turn it into an isolation ward. Okay, it has a 3-story building which can accommodate nearly 100 people. So this has been offered to the government so that they can be converted into isolation ward, and it is the largest madrasa. So what it says is compassion is the universal religion. Okay, so there is this religious equality, and when there is a crisis that the humanity is faced, then these religious boundaries are no longer there. We all are one, and only if we stand together we can we can overcome the crisis. So this is what is shown in this piece, and this can be used in ethics case studies where they talk about anything like religious intolerance or communal violence. So you can use all these kinds of case studies to enhance your answer, and these are all the value addition material. Okay, the second example is that a measure that is taken by the Uttarakhand government. It has given a life insurance cover of 4 lakh each to the frontliners in the battle against coronavirus. So what it shows is it shows that it's an aspect of good governance, it's an aspect of welfare state. So this can definitely be used as an example in ethics, where in ethics definitely the syllabus mentions about good governance. So this is what the frontliners are, the ones who deserve the most to be given assistance at this point of time, because they are fighting this on all of our behalves and for all of us to save all of our lives. So in this regard, this can be used in various case studies and also in the answers in ethics. There was another small piece of information which pertains to the GS3 environment on forest fires. So this was about the Kawal Tiger Reserve in Andhra Pradesh. So actually what had happened here is that there was a large number of forest fires in this Kawal Tiger Reserve, and upon investigation it was found that one is there were these BD contractors. These BD contractors actually need tendu leaves. So they will be able to collect these tendu leaves. To be able to collect it, the forest floor has to be more clear. So that is why they purposefully ignite the forest so that the ground level vegetation is cleared and they have access to these trees so that they can collect the leaves for manufacturing BD. So this is one. And the other is there are multanis of Sirikonda. These multanis are actually timber smugglers. So they actually purposefully fire the forest so that the vegetation is cleared and there is a lot of nobody comes there because there is fire, and they can easily smuggle the timber. So you can use this as a case study. Whenever there's any question on forest fire, you can use this example of Kawal Tiger Reserve, and you can tell the exact reasons of BD contractors for Tendulis and Multanis of Sirikonda who are timber smugglers. And these are very relevant examples whenever you write any answer on forest fires. So we have a question today for you which says critically comment on India's preparedness in handling biological disasters. It is a 15-mark question for 250 words. Answer has to be written on it. And on the next day, that is tomorrow, before starting the class, I will be discussing on the exact body of how it should be addressed, how their question should be addressed. So do write the answers and keep it ready. You can also post the answers in the comment section. So thank you very much.